Good afternoon. When we started, it was morning. Now it's afternoon. I want to welcome you all again to the information session that we're holding today for the Master of Science in Speech Language Pathology here at New York Medical College. I am Kate Franklin. I am the department chair here and associate professor in the program. I have with me today two other faculty members, Dr. Monica McHenry and Dr. Vikas Grover, who will be here when we're done to answer any questions. We'll all be answering any questions. We also have on staff. We'll have a very close relationship with her. Michelle Novotny, who is our Associate Dean for Admissions and Enrollment Management, will be a contact of admissions. So everybody should have a packet. I'm going to just run through in this packet so you know what we have going on. First, you've already had your tour, and now I'm doing your little welcome and overview. Second thing in your that side, we'll find out about our department. In there, you'll find information about our requirements, our mission and vision. It'll have a list and pictures of faculty members, list of our adjuncts, list of all of our clinical educators. So you'll see that there are a number of people who are involved in educating students in the discipline of speech language pathology here at New York Medical College. Other things in the packet are a couple of articles from our on-campus publication called In Touch. So one highlights an overseas program that we have available to interested students. And two others are articles on interprofessional education activities that we have ongoing with our colleagues in the Department of Physical Therapy. Those are there for you. The other sheet, the bright one, lists people in the department, and then there's also information about student housing. You should all also have a set of the slides that we're going to be reviewing today, and we'll go ahead and get started with that. Or not. Oh, magic. It's magic. So who do we serve as speech language pathologists? We serve children and we serve adults. We cover the lifespan. So just in terms of a few statistics, for communication and swallowing disorders in children, there are about 1 in 12 children in the United States who presently present with speech language or swallowing disorders. In the area of adults, we have about 1 in 25 adults who present with swallowing disorders at any point in time, about 1 million adults who have aphasia, about 3 million adults who have fluency disorders, and about 3 million Americans who have complex communication needs and cannot use their natural speech for communication. So a wide range of populations and disorders that we treat as speech language pathologists, and there is a need for speech language pathologists. Our program here focuses on training students to work with people whose communication or swallowing deficit is part of a more complex congenital, developmental, or medical disorder or traumatic injury. So we focus on the whole person and understand that that person comes to us with a very complex set of issues, psychosocial issues, medical issues, and we're part of a team, right, that serves those individuals. So we may start with babies in the NICU. That baby may grow up to have some deficits in language. That baby may grow up to have communication disorders that are so significant that they require augmentative communication to be able to effectively communicate. that individual may have a feeding disorder. On the adult side, we work with individuals in acute care settings, subacute rehabilitation centers, long-term rehabilitation centers. So we may see that person in the acute care setting. We may then see them as an outpatient for aphasia therapy, swallowing therapy. So that just gives you a little overview of who we are and what we do. Our program here specifically has a set of principles that we sort of developed, that we put together as we developed the program. So we train our students to fulfill the expanding role of speech-language pathologists within healthcare settings. We love to teach our students to be able to critically analyze and apply evidence-based principles to any treatment or evaluation that you do. Why are you doing it? What evidence do you have to support what you're doing? We believe in advocating for the persons that we serve. We spend a lot of time in professional issues and ethics, discussing advocacy for our patients with communication disorders and their families. We have a very diverse population of individuals that we have available for our students to have experiences with, both in our in-house clinic and also in all of the externship experiences that students have. So we have a diverse population of individuals that are served. And we also value and teach our students that you need to be a lifelong learner, all right? You come out of a 21-month program in speech-language pathology, you have your master's degree, right? And that's really just the start of your professional career. And as a professional, your obligation to keep current with the literature and to keep current with new trends. We think we have some very unique features in our program here at New York Medical College. One of the important things is that our students begin at the same time and they end at the same time. So we have a cohort program. We have, and you'll call me a liar, but we have no electives in this program, all right? Every course is a required course. So you don't have the option of taking voice disorders or not. The core curriculum is designed so that you have the underpinnings necessary to practice in any aspect of the field that is of interest, all right? So we don't have options in coursework except for two, all right? So we have two little add-on experiences, if you will, for students who are interested in a little bit more. So the first additional activity is research experience. So students who are interested in engaging in a research project can work with a faculty member on a research project that they may have ongoing. So that's available for interested students in addition to the rest of the curriculum. And we also have an overseas clinical practice. That happens during the summer for a few weeks. Right now we have students that go down to Puerto Rico with Dr. Raquelme, who is our dysphagia expert here. And he has a relationship with a university there, takes a group of our students down who are interested in seeing what healthcare and speech-language pathology is like somewhere else besides the continental United States. Other features of our program is that we find important are a clinical readiness series that we have during the summer in August. When you start the program, you spend your first three and a half weeks immersed in activities and coursework to prepare you for clinical practice that begins in September. So in your first semester, we'll have you in the clinic. And students have clinic every semester that they're in the program, all right? So It's a 5-semester program. You're going to have 5 semesters of clinical practice. So this clinical readiness series teaches you about clinical processes. It teaches you about evaluation processes. It teaches you about how to transcribe a language sample, how to transcribe a speech sample, all right? So we get you ready, all right? And specifically, it's all clinical activities to get you ready for clinic beginning in September. One of the other things that we run throughout the program is a mentored writing activity for students who may need some extra work in establishing good clinical writing skills. We find that that is something that's not always easy for everyone to do, is sort of move from your academic writing to your clinical writing. So we have this little mentored experience for all students, and then extra experiences for students who may need a little extra guidance in that area. All students in the program go through the training for the Lee Silverman Voice Therapy. It's called the LSVT Loud program. All students have specific a day-long course in FEES training, which is fiber optic endoscopic evaluation of swallowing. And all students participate in a variety of interprofessional education activities that we have with our friends in the Department of Physical Therapy. So our academic curriculum is medically focused. You saw the anatomy lab. You'll be in that anatomy lab. We believe that it's important for you to see those structures. Where did those cranial nerves originate, right? What does a brain look like? What happens when I cut open that brain? What's on the left side? What's on the right side, all right? So you get in there. The professor who teaches that is a retired surgeon, and he has really geared the course that we have for you all as a course that is specific to head and neck. So you get in there, you get to see what a larynx looks like, all right? We think it's an important thing. We have a neuroscience sequence. Why? Because neurological impairments will exist in about 90% of the adult speech language pathology caseload and in about half of the pediatric caseload. So you need to know neurology, all right? You need to have a good grounding in neuroscience, and that translates into being able to problem solve in your clinical coursework related to neurological impairments. We have a medical management sequence that runs over 3 semesters, where you learn what happens in a hospital room. What are those monitors? What are those tubes? What is that stuff that is attached to a person in a hospital setting, all right? And you learn about the business of speech language pathology in a medical setting. We have coursework that covers pediatric and adult communication disorders. We have bioinstrumentation that is clinically based, so you learn the tools that you need as a practitioner. And we also have coursework in the area of augmentative and alternative communication, AAC. We run a specialized diagnostic practicum, both here at Westchester Medical Center and also at New York Presbyterian Brooklyn Methodist Hospital, where one of our faculty members runs the speech and swallowing practice down there and takes our students. So we think that in terms of what we offer, kind of above and beyond what a typical speech language pathology curriculum has available, you can see that we have quite a few interesting additions to the program. Clinical work, as I said, goes across all 5 semesters of the program. Your first 2 semesters, so fall and spring, we keep you here. And here means Boston Children's Health Physicians, Division of Speech Language Pathology. We are in a very fortunate position here at New York Medical College to be the faculty practice and the Division of Speech Language Pathology for a very large pediatric physician practice. So some of you who are from the area may remember Children's and Women's Physicians of Westchester, a large, about a 300 physician practice for women and children in Westchester County. Well, it is now part of Boston Children's Health Physicians. So we're their Division of Speech Language Pathology. So our students are trained in our clinical site here, doing outpatient diagnostics and therapy. We run some social skills groups, and we also have a communication group for adults with aphasia. Most of the referrals that we get are from network physicians who may have a child or an adult who has some concerns with communication, and those physicians refer directly to us. So we've been able to build a really nice clientele of interesting language cases, both on the pediatric and the adult side. We also have a very large feeding program here, a pediatric feeding program, and we were able to secure some grant funding to really develop that pediatric feeding program. So NICU referrals from the hospital come directly to us because they're Boston Children's physicians. So we can see those babies soon after discharge from the NICU, but we also follow children and get referrals from the community for kids with feeding disorders. As I said, we also have an inpatient diagnostic experience during your first 2 semesters, where you go down to New York Presbyterian Brooklyn Methodist Hospital for about 4 Fridays, or Tuesdays or Fridays, where you are learning the culture of the hospital. You're learning what it is that we do in a hospital setting, so it kind of eases you into that experience. And then we also do preschool and different community screenings during your first 2 semesters. The last 3 semesters of the program, you are sent out, all right? So we have 3 external rotations for our students. And we have been very diligent and very busy in developing rotations for students that will help you to meet your needs as a clinician and to serve the population that you're interested in, but also to ensure that we're meeting the standards for an accredited program. So what that means is you have to have experiences across the lifespan, and you have to have experiences with pediatric and adult patients. So we've developed 3 different experiences for students, and every student will have each of these experiences. So 1 semester will be in a healthcare setting, all right? Now, that doesn't necessarily mean a hospital, all right? There are many things that classify as a healthcare setting. So it could be an outpatient medical setting, it could be a rehabilitation center, it could be an acute care hospital, but we find that some students aren't really interested in acute care, so that's fine. You don't have to go to an acute care. You can go to a different kind of a healthcare setting. We are developing and have in place another practicum that's called Modules for Medical Competencies. We've spent a lot of time, a couple of years, developing rotations within different settings, helping students develop medically based competencies, all right? So what happens in that rotation is the students in that group will go to the hospital over here for a period of 6 weeks, and you will be doing cognitive linguistic evaluations. You will have experiences doing bedside swallowing evaluations. You will have experiences doing instrumental swallowing evaluations. You may be doing feeding therapy with patients in acute rehab. You will be having experiences with our inpatient psychiatric patients, the pediatric patients. You may spend some time in the NICU. You'll then go to St. Mary's Hospital in Queens, where we run an AAC language group with kids there. Then you might be going down to New York Presbyterian Brooklyn Methodist Hospital, where you will have more experiences in critical care. So you'll have different modules of experiences that are all geared toward making sure that you have the competencies that you need to be able to meet the healthcare needs, right? Speech language pathology needs of patients that you serve or clients that you serve when you graduate. The other practicum for everyone is a school-based practicum. Why do we have a school-based practicum? Because you need experiences with the pediatric population, and we provide our coursework sets you up for the initial certificate as a teacher of students with speech and language disabilities in New York State. So as part of that, the ability to get teaching credentials in New York, you have to have a practicum in a school setting. So we just ensure that everybody has that opportunity available to them, so that should you choose in the future or when you walk out the door to work in a school-based setting, you're prepared to do so and you have the credentials to do so. So what happens to our graduates after their intensive 5 to 6 months here? They provide services in hospitals and rehabilitation settings, both within the region and nationally. Some of our friends go and work in nursing homes, outpatient rehabilitation settings. Some move into the private practice setting. Many of our students go to work in the schools. We have had some students who've gone off to fellowship experiences. In particular, we've had one going off to a public health fellowship at the National Children's Hospital in Washington, D.C. And we've also had a student going on to a clinical fellowship at the Cleveland Clinic. We also have students who go on for either their clinical doctorate or a PhD following graduation or a few years after graduation. So what is it special? What is special about the speech language pathology program here at New York Medical College? Well, we are one of the few graduate programs in New York State whose curriculum covers completely the scope of practice of speech language pathology. Again, because we don't offer core coursework as any elective, you're required to take it. You meet all of the benchmarks, okay, in terms of what you need to practice when you graduate. We are one of the few programs nationwide that specifically prepares speech language pathologists to work in a medical setting. Again, you may choose not to work in a medical setting, but regardless, you have a good base of foundational information that prepares you for any work setting. And what we know is that many children in school settings, right, are more likely to be in their neighborhood school than in a specialized school. So you would actually be the speech language pathologist who has expertise and knowledge in the area of feeding for any kids in a regular neighborhood school who might have some feeding concerns. So, or kids who may have suffered a traumatic brain injury and who's trying to remain in their community school. We are also focused on clinical experiences across the lifespan. So we spend a lot of time making sure that you have sufficient and appropriate pediatric experiences, sufficient and appropriate adult experiences. But you know, it's all about the outcomes, right? So our students, we have a very successful pass rate on the national exam in speech language pathology. And you'll see that we are always above the national average. Data are not yet in for the 2017 cohort in terms of the national percentage, but you can see from the previous years that we're well above. So what is it about speech language pathology that's appealing? Well, to parents, it's because your child can get a job, right? That's a good thing, and a decent paying one at that. So this is just from the Bureau of Labor Statistics. This is just information that talks about what the median pay is, entry level, degree, on the job training. So students have to complete a 9-month, what we call a clinical fellowship after graduation. It's your job, you get paid for it, right? But it's actually additional training, sort of on the job training that you get to ensure that you have all of the clinical competencies that you need. And it's specifically for where you're employed, right? So with whatever populations you happen to be working with. So I'm not gonna, oh, and the job outlook is good. So it's a faster than average job outlook, which is nice. And our program is fully accredited by the Council on Academic Accreditation of the American Speech, Language, and Hearing Association. As you're out perusing programs, right, this fall, as you're thinking about graduate school, make sure that you are applying to programs that are accredited. And we had our last accreditation visit in 2011. We're up against one here pretty soon. I'm super excited. But anyway, our site visit chair wrote this to us. She said, I'm so pleased that our trainee, so a site visitor who was learning how to be a site visitor, got to experience a visit to a program that meets or exceeds the standards in nearly every way. Now, they now have a frame of reference for excellence. So that's what our accreditation body is saying about us. So we're pretty proud of what we have to offer here at New York Medical College. Pam is going to come and talk to you a little bit about the application process.
No, I don't. Just stay here. So how many have applied already through ZCast? Not that many. What, anyone in the process? Who's in the process? Okay, quite a few. Anyone for the following year, or just all of you for this year? Anyone for next year? Nope. Okay, good. So you're familiar with the ZCast application process. There's a centralized application, and there are other schools on there as well as ours. I'm sure you're familiar with this, which is the application for you to sign in on. Any information that you need to know about our program is very well documented on our website, and it's been recently updated with a lot of really good information, prerequisites, admissions, faculty, everything you want to know about our program. So if nothing was answered today and you want to learn more information, please go to the website because it's just a wealth of information. And of course, contact me or Dr. Franklin or Jennifer or Michelle if you have any other questions as you're proceeding through the application process. So you're all familiar with this. If you haven't gone on to the application yet, there's a link on our website directly to the application. So everything goes to ZCast. So you don't send anything to us till after you're accepted into the program. So you get 3 recommendations. You put the names of your recommenders online, and they get a form that they fill out, and that's in your application. You request all your transcripts, and they go directly to ZCast. So important things. So we do require the GRE. ZCast has their own GRE number, which you probably have seen. It's not our school number. It's our school number for ZCast. Anyone with a foreign transcript? Okay, good. But if there were some foreign transcripts, you have to have them evaluated. And you have to take a test for English. So the personal statement is 750 words. Be very careful how you answer your questions, and really take the opportunity to tell us more about yourself and your passion for speech-language pathology, and your passion maybe for the school and for the medically oriented program. Make sure someone proofreads your personal statement. No typos, no wrong school. Make sure you read it a couple of times and have someone review it with you. So that jumps out at the reviewers. It's important. 3 recommendations. At least one must be from a faculty member that you've taken at least one course. Very important. No recommendation letters from online course instructors. We want on-campus faculty to give the recommendation, okay? Because they don't know you as well as an on-campus faculty person would. No letters from friends, relatives, colleagues. And if you've been out of school for a while, supervisors and bosses and upper management. These are the following requirements from ASHA. So we need biological science, and that could be biology, human anatomy and physiology, neuroanatomy. You can see it, human genetics and veterinary science. For your physical sciences, it has to be physics or chemistry. And for statistics, standalone. And for behavioral sciences and social sciences, psychology, sociology, anthropology, or public health. So what's not listed, but we're going to go over it, is the department requirements. And they are phonetics, one course in phonetics with phonetics transcription component. It's in your brochure if you can't find it. One course in anatomy and physiology of speech or speech hearing. And one course in child development, child language development. Do you want to say anything about those particular courses? Because I get a lot of questions and I want to make sure that they understand.
So one of the things that we don't require in this program is an undergraduate degree in speech language pathology. All right, so that's one thing that you need to understand. For many years, we did not require any prerequisite coursework besides the ASHA prerequisites that are listed in the slides. Over the last few years, we have opted for these other 3 electives, or these other 3 requirements, program requirements, because it helps to get you ready. We found that students were having a little bit of difficulty catching up because they didn't have a background in the discipline. So those 3 courses are the ones that will help to get you ready for graduate school, right? So that's why we recommend those courses. Some of you who don't have a background, may be taking some of those online 7 or 8 courses that are offered, which is perfectly fine. We don't require that. All right, and we're not going to make you take any additional coursework when you're here. We basically start from the beginning and work our way through, all right? But those 3 department level requirements for admission really help to ground you in the discipline. You can apply without having those courses taken. You just need to make sure that you have them done by the time you begin the program.
If you have any questions about the prerequisites after you leave here and you're not sure they meet our requirements, you can call our department. We'll help you walk through the process and review your course descriptions if there's some questions. So CITCAS requires a $100 application fee, and for every school that you apply to, there's an additional cost. Require the personal statement, make sure it's carefully worded, not generic, to all schools, make it personal to each school. 3 recommendations. There's a prerequisite portion of CITCAS where you put in all your prerequisites. Some could be pending in the spring semester, we know that. You may not have completed all your prerequisites by the time you apply. You may have, there's a place in CITCAS for you to put down all your pending prerequisite courses. It's a special section. We need transcripts from all post-secondary schools. So we will not be reviewing your application without all the documents available. So as soon as you get all your documents and your transcripts and GRE, we'll be able to review your application once it's complete. And then there's a small verification time that CITCAS takes to verify your grades against what you entered against what you submitted with your transcript. So the application deadline is January 15th, 2019, next year. However, we will be reviewing applications on a rolling, ongoing basis through next year. And I guess Dr. Franklin will talk to you a little bit about the interview process and how that's all going to work. Thank you. Call me if you need me.
So we review applications, department faculty review applications, and then we invite students to campus for an interview. So the interview really consists of learning more about the program. We want to get to know you a little bit better. You need to get to know us a little bit better. We have a few I'm not going to give away any secrets, right? So we have some activities that we have you complete as part of that interview day. One of the best parts of the interview day is you have lunch with some of our students, current students. So you get to ask them all your real questions, right? And then we're here as well to answer any questions that you might have as you're thinking about graduate schools that you want to attend. All right, so there's student financial aid, all right? So I'm not Tony Sozo. He's the Associate Dean for Financial Aid, and he's a great human being, and if he was here right now, he would say, if you want to come to New York Medical College, we can make it happen. So there you go. So what he has put together are just a few slides that talk about the cost of coming here, what the off-campus budget is for this year. It's not been determined for next year, both the off-campus budget and an on-campus budget. We do have housing on the premises for students in our program. There are different types of loans available through the federal government. This slide tells you what those are and what the current interest rates are. There are also some scholarship opportunities. One that we are part of is the New York City Board of Education Scholarship. So that is a scholarship that you apply for. And if you get it, and that usually comes out in May, if you get that scholarship, then you let wherever you want to go to school know that you are a scholarship recipient, and they will cover the cost of your tuition for the time that you are in graduate school. And then you owe the Department of Education in New York City, I believe it's 3 years of your life. Don't quote me on that. So 4 years of your life. So for every year you're in school, you owe them 2. Thank you. So it would be 4 years, okay? So the good news is you have a job when you graduate, guaranteed job, okay? And they have worked with us for many years, and they like our students. So they know the experiences that our students have had and what our students' sort of eventual outcomes are. So they try to place you in the area of the New York City Department of Education where you're going to get your needs met as well as theirs. That's all I can say about that. There are some internal scholarships that we have. I don't know what the value of those are today, so I can't really talk about that. This is the website for the Office of Student Financial Planning. I told you about the TeachNYC Scholarship. There's a little bit more information on that. Here are some screenshots of some sites you might want to peruse. Student Federal Aid, federal student aid site. And then this is a medical school for students wanting to go into medical school, but the Association of American Medical Colleges also has a lot of good information on loans and paying back loans that might be of interest to our students as well. So Tony, again, is a very nice person, and he will happily pick up the phone and answer any question that you have. He loves to make things happen for people, and he's very good at doing it. And he's very proud of the very low default rate that New York Medical College has. So there you go. There is student housing. That's what it looks like. That's what the inside of some of those places look like. Never been there. So anyway, thank you. We appreciate you taking the time out of your weekend to come and visit us. We are here to answer any questions that you have for the next however long you are going to be here. And we welcome your applications. Thank you.